The streets and shopping malls of Beijing are empty, but the pharmacies and clinics are packed. As COVID-19 explodes across China, many confront a threat that they are unfamiliar with and unprepared for.
担心肯定是担心自己也会感染嘛，因为毕竟现在这个病毒扩散的这么快，然后现在这个也全国也已经放开了，也是害怕自己也会生病嘛。
药以前在家里就已经备过了，提前已经有那个准备，所以也不需要特意去排队上那个药房去买药。现在买药，药房也排队，人特多。
China's health authorities reported around 2,000 new cases on December 14th. That was less than the day before. But they have also changed how they count cases, admitting that the total number of asymptomatic and mild cases is essentially unknowable. The surge in infections comes after a sudden loosening of restrictions. But the World Health Organization disputes a causal link between the two.
The explosion of cases in China is not due to the lifting of COVID restrictions. The explosion of cases in China had started long before any easing of the zero COVID policy.
According to the International Health Authority, China's stringent and officially Trump defenses against the pandemic had already failed.
There's a little narrative at the moment that in some way China lifted the restrictions and all of a sudden the disease is out of control. The disease was spreading intensively because I believe the control measures in themselves were not stopping the disease. And I believe that the Chinese authorities have decided strategically that for them is not the best option anymore.
Since the outset of the pandemic 3 years ago, China has excelled at building mass quarantine facilities, sealing its borders, and imposing tight controls on its population. But critics say this distracted them from bringing in more advanced foreign vaccines, inoculating the vulnerable, stockpiling medicine, and improving hospital capacity. As China faces a hitherto unknown surge in cases, the way society responds will test this approach. Kilpatrick for TaiwanPlus.